Now, I'd also like to address another deeply concerning matter, detainees who died while in your custody. Secretary Mullin, since Donald Trump took office, DHS's immigration detention system has been plagued by medical neglect, abuse, overcrowding, and a historically high death rate. I saw these dangerous conditions with my own eyes when I visited the Miami Correctional Facility in Bunker Hill, Indiana, where I met with individuals who told me that it takes months to receive medication refills, including for life-threatening illnesses like diabetes. Others reported being left unattended with infected boils and other serious conditions. So it's no surprise that a detainee at that facility died shortly after my visit, or that more detainees died in ICE custody in 2025 than ever before. Secretary Mullin, does DHS have any official, specific internal goals or policies to reduce deaths in custody?
Ma'am, your numbers just aren't accurate. We've had 0.009%.
Mr. Secretary,
You're asking about this. It's 0.009% of deaths. And we've had 54 total in the president's time. Those are dangerous accusations you're making.
Mr. Secretary.
Those are dangerous accusations that she's making. Because in the state of Illinois, they're twice as high to die in the state penitentiary of Illinois than they are in detention.
You are invited to this committee. This is my time.
And you need to be informed by what you're saying.
I am informed.
No, you're not, ma'am.
Mr. Secretary, does DHS have any
do you realize that we have one doctor per 1,000 for detention centers for our federal detention centers in the state of Illinois? They have one per 1,800, but yet she wants to focus on our detention centers?
That. You'll get your time.
Thank you.
You're welcome. So I guess this is a good place to stop. We are trying to keep members to 8 minutes. Mr. Secretary, you know that too. That's fine. So we all know how the clock runs here. The idea is to get together to forward questions. I'm going to have you repeat your question when we start up again.
Thank you.
But I can tell you this, if this format won't work, then we'll reschedule the meeting for later when we can keep it to all the issues accordingly. So this is the efficient way to do it, but if we can't do it the efficient way, then we'll go to Plan B, which will not be today. And I don't mean that as a threat to anybody. I'm just saying this is not Meet the Press or Fox News or whatever for anybody involved. It's what's the question, what's the answer? Mr. Secretary, if you need more time to respond to that, the committee will make any of your comments part of the record, and we will endeavor to make sure that you get to meet with whoever wants more time. But while we've got the whole committee sitting here, we're not going to do the XYZ debate, whatever the heck. So, ma'am, please repeat your question, and as near as I can figure, you got about 4 minutes left.
Thank you, Mr. Chairman.
You're welcome.
Secretary Mullin, does DHS have any specific internal document, policies, or goals to reduce deaths in custody?
And we do a wonderful job on providing medical to.
Sir.
We're doing a wonderful job at it. We have 0.009% of deaths in our prison,
whether the department that you lead,
which is a lot better than the state of Illinois.
Is it your testimony that you do not know whether or not the department that you lead has a policy to reduce deaths in custody?
No, I did not say that, ma'am.
You didn't answer my question.
Yes, I did. You're making accusations, and you're not even looking at your own state.
No, you have no policy or plan to reduce deaths in custody.
That's not true.
2 months ago, I asked ICE.
Our medical staff does a phenomenal job. In fact, every detainee sees a doctor or a nurse with every 2 weeks.
I reclaim my time.
Okay, ask your next question.
Okay. 2 months ago, I asked ICE Director Todd Lyons the same question. He said that ICE, quote, hopes that there will be no deaths in custody, but admitted that the agency had no actual policy in place to prevent them. Rather than implement one, he resigned just a few hours later. Secretary, since that hearing, 3 more people have died in ICE's custody, and those are the only deaths we know about based on your agency's public reporting. So, Mr. Chairman, I would like to request unanimous consent to enter into the record a report that came out today from Human Rights Watch and Physicians for Human Rights titled Dying in Detention, Rising Deaths in an Expanding U.S. Immigration Detention System.
Without objection, so ordered.
Thank you so much, Mr. Chairman. Drawing on government records, detention data, and expert medical reviews, this report outlines 52 deaths in ICE custody during President Trump's second term and highlights the concerns we've been raising to your department regarding the lack of access to medical care, suicide prevention, transparency, and accountability in detention facilities. Secretary Mullin, ICE's detainee death reporting has not been updated since April 28th of 2026. The death rate in ICE custody has doubled during President Trump's second term. Will you commit to reporting detainee deaths as required by law?
We do report them, ma'am. No one,
So is it your
I don't know.
testimony then
We
that there
report
is
these.
no...
What you're talking about is what Congress has asked us to do, which we're not required to do, is report the deaths after they're released. That
no.
doesn't make any sense. They're not
Okay,
under our
Mr.
watch at that
Secretary,
point. If
is
they
it your
die in our
testimony that
release,
you are
we
Is it your
report them.
testimony that there have been no deaths since April 28th?
I didn't say that.
Okay, so are you going to commit to complying with the required reporting requirement?
And we were shut down for 115 days under this
Claiming my
department.
time.
So I don't know what
Secretary.
we just now reopened. So I don't know what reports
Mr.
you're wanting us to
Chairman,
do
I
when
don't
you're
know what to
willing to
claim,
fund
Mr.
us.
Chairman.
You want the reports, but you don't want to fund us? That makes no
Secretary's belligerent
sense.
here and has been taking up my time.
What's your next question?
My next comment is that the ICE
No, there's no
director-
questions. It's just comments.
No, I had a question. He didn't answer my question. And so
So the record will reflect that. What's your next question?
yes, sir. There is a policy of reviewing and publicly reporting deaths that occur within 30 days of a detainee's release from custody. And that policy existed to prevent ICE from avoiding accountability by releasing seriously ill people shortly before they die. And as a nurse, I find this deeply troubling change in their reporting posture. Families deserve answers, and Congress should be able to conduct oversight, and the American people should have confidence that deaths connected to federal detention are not being hidden through administrative loopholes or filibustering. Transparency is not optional. There are laws and reporting requirements, and if this administration is unwilling to account for what happens to people in its custody, then it's Congress's role to question whether it deserves more authority, more detention capacity, or any additional cent from the American people. Mr. Chairman, thank you for letting me finish my comments, and I yield back.